Good afternoon, everyone. I'm Tom Stolz, the County Manager, and I'm here on August the 12th to give the COVID-19 update. Let's start like we usually do with national numbers and work our way to local, and then kind of talk about the scene here locally with the health department's management of the virus at this time. So the numbers from Monday compared to today in the country, we went up 1.86%. So that's 5,168,685 cases today in the country. In the state of Kansas, we went up 2.57%. So that's a total of 32,547 positive documented COVID cases today. The Kansas death count stands at 395. And in Sedgwick County, we went from 4,945 cases to 5,068 in the last 2 days. So that's a 2.49% increase. Our peripheral counties numbers, Harvey County with 218 positive cases, Butler with 314, Cowley with 178, Sumner with 99, and Reno at 360. Of the total COVID cases in Sedgwick County, 5,068 of them, 2,209 are considered recovered, and our death count in Sedgwick County today stands at 46. In our weekly comparisons, our numbers are getting slightly better over time. Compared to last Wednesday when we met, we increased 11.63% here in Sedgwick County. Our recoveries increased 35%. And our death total went up almost 7%. We went from 43 deaths last week to 46 this week. Almost 63,000 residents have been tested for COVID-19 in Sedgwick County, and 189 residents were scheduled to be tested at the Sedgwick County Health Department drive-through this morning. The Sedgwick County Health Department offers no-cost testing of symptomatic residents and those people working in certain high-profile professions who cater to people who are at risk. And to get that process started, it's still calling 211. This week from 8:30 a.m. to 11:30 a.m., the mobile outreach team will provide no-cost COVID testing for symptomatic residents at the Pathway Church, which is located at 18,800 West Kellogg in Goddard, Kansas. So that's 8:30 to 11:30 on Thursday, August 13th at the Pathway Church in Goddard. Today at the County Commission meeting, there was a lot of discussion about CARES funding. The Commission approved some CARES expenses as they do every week. We talked a little bit of time about the CARES Economic Recovery Plan. Brent Shelton got up and gave an overview of the $9.3 million that the county received from the state to address our businesses and economy recovery plan here in Sedgwick County. They did approve one purchase under CARES money today from the external team, and more information will be coming out on that over the next few days. The Commission, of course, approved the budget today, and tomorrow we have a special meeting, and the subject of the special meeting tomorrow is going to be what to do with testing in Sedgwick County. We will be looking at a number of options to enhance and increase our testing capacity here. We've talked about it many times that the testing in Sedgwick County, really from the beginning of the virus, has languished for different reasons. Initially, it was because we could not get commodity and product. Then it became we couldn't get the turnaround of the tests happening fast enough. The number of cases as a country increased, and the labs became inundated, and we end up in Sedgwick County today with a test timing of anywhere from 4 to 8 days to get results back, and that makes it very difficult for our health department to try to manage the virus. It makes it hard for people to go to work or go to school or live their lives. So we're trying to increase the capacity and shorten that time from when you take your test to when you get results. So we're going to be having that discussion tomorrow with the Commission. We have some options here locally, and the Commission will hopefully give us direction tomorrow on how to proceed. So as you know, our CARES money, a huge chunk of our CARES money to serve all populations of the county was earmarked at testing. Make it faster, make it better, and hopefully get to a saliva-based testing or some other type of testing module which would allow us to process more of these in a faster mechanism. So it'll be a good discussion tomorrow at the special meeting, 11 o'clock tomorrow. So hopefully more to report next week. Thank you for your attention today, and call if you have questions.